The way that I always think about all of the tasks and chores around taking care of your child with diabetes is that you have to become, or your child has to become, an artificial pancreas. And there are three things that the pancreas has to do. It has to produce insulin, of course, so that's like your shot. It has to be able to it has to be able to know in some way or fashion what the blood sugar is, because it obviously doesn't want to give you a whole bunch of insulin if your blood sugar is already low. And thirdly, it has to have some sense of what kind of food and what amounts of food are coming into the system. So when it comes to children with diabetes, we've already talked about insulin. A second important component is monitoring blood sugars. And typically blood sugars are measured before the child eats, so typically before breakfast, lunch, and dinner. For many children, they also will monitor before they go to bed, and particularly for younger children, we have blood sugars checked typically at 2 or 3 in the morning just to be sure that the child is not having a low blood sugar. But the relevant point is that monitoring is a tool, and it's maybe used 10 times a day when the child is sick, when you're not sure how much the child is going to eat, when you think that maybe you gave the child a little bit too much insulin, or your child has been particularly active, you might monitor more frequently. But the general expectation for most children is, we always say 4 or more, which means a minimum of 4 checks a day. But a lot of times, as a physician, I will recommend checking at some additional times, because there are additional pieces of information that we need to help make good decisions about dosing of insulin or making recommendations about food and food intake.